Hi, my name is Sharon Vigil, and the title of my presentation is Information Dissemination and the Ebola Outbreak. I will be talking about the 2014 to 2016 Ebola outbreak in West Africa. My discussion will include the positive and negative impact of media, information needs of individuals in West Africa and in the United States, and the communication challenges that were present during the outbreak. I will also touch on the current Ebola outbreak in the Democratic Republic of the Congo, also known as the DRC. I will begin with an overview of the West Africa Ebola outbreak. The epicenter of the outbreak was in three countries in West Africa: Guinea, Sierra Leone, and Liberia. However, sporadic cases also appeared in Nigeria, Senegal, Mali, Italy, Spain, and the United States. The World Health Organization, otherwise known as WHO, officially declared an Ebola outbreak on March 23, 2014. The index case turned out to be a 2-year-old boy from a small village in Guinea who died on December 6, 2013 from the disease. This map gives you an idea of the severity of the Ebola outbreak. The date is November 30th, 2014. Here are the final statistics of countries with widespread transmission and other countries that were also affected. As you can see, there was a total of 28,652 cases and 11,325 deaths. The 4 cases in the United States did not include the 7 individuals who were infected in West Africa and came back to the US for treatment. The information needs of individuals in West Africa were different from the needs of individuals in the United States. A majority of the population in Guinea, Sierra Leone, and Liberia did not believe the Ebola virus was real, but rather a conspiracy created by the government. Some believed the virus was caused from witchcraft. Medical mistrust was also a major problem, and many West Africans believed health officials meant more harm than good. Another misconception was that the Ebola virus was being spread by Westerners. In the US, information needs were based on fear and panic once the media reported that the Ebola virus had come to the United States. Americans needed reassurance that there was not going to be an outbreak like the one in West Africa. It was extremely important that trustworthy information was shared in a timely manner with continuous updates. Media involvement. The media played a significant role during the Ebola outbreak. In West Africa, one of the primary ways people got information was through community radio. During the outbreak, radio helped to raise awareness about the disease and reinforced behavior change communication. Programs were broadcast in local languages or dialects. One popular program called Mr. Plan included characters that the community could identify with, and it provided important information and advice about preventing transmission of the virus. Since radio broadcasts were run by trusted experts in the community, listeners were more likely to trust the information. Television and the use of cell phones were also ways in which individuals in West Africa obtained information about Ebola. In the United States, social media, television, and newspapers were the most popular sources for information about the outbreak. Social media was very effective in spreading factual information about Ebola, but it was also a catalyst for the spread of misinformation and rumors that increased fear and panic. There was a delayed global response to the West Africa Ebola outbreak. In the documentary, Facing Darkness, medical missionaries from the Christian organization Samaritan's Purse talk about their experiences treating Ebola patients in Monrovia, Liberia. Between June 2014 and August 2014, only Doctors Without Borders and Samaritan's Purse were treating Ebola patients, and the outbreak was spiraling out of control. Samaritan's Purse requested additional help, but nobody came. The wake-up call that was needed in order for the world to realize that Ebola was a global threat happened when Dr. Kent Brantley, a missionary doctor with Samaritan's Purse, was diagnosed with the Ebola virus and was transported from Liberia to the United States. Nancy Wright-Bull, who was working with Dr. Brantley, was also infected and would be returning to the United States. The media was all over it, and Americans were scared and angry that the CDC had agreed to allow Dr. Brantley and Wright-Bull to go to Emory University Hospital for treatment. Dr. Tom Frieden, the director of the CDC, received multiple death threats, and there was a lot of political upheaval. But the consequences of the decision saved Dr. Brantley's life and gave him the opportunity to advocate for people living in regions affected by the Ebola outbreak. The outbreak was finally being taken seriously on a global level, and the US and other countries joined the fight to stop the outbreak. In September of 2014, Thomas Duncan from Dallas, Texas, was the first person in the US to be officially diagnosed with Ebola. From that point on, rumors and fake news became even more of an issue. This slide shows the headline of an article published on BuzzFeed Live called "Texas Turkey Farm Contaminated with Ebola, Over 250,000 Holiday Turkeys Infected." The article, which claimed that an employee showing symptoms of Ebola potentially contaminated turkeys that were shipped all over the United States. This article was shared with millions of people through social media. Another rumor that was generating during that time was that Ebola had mutated and become airborne. The WHO refuted this rumor by posting information on its website and sharing it with the media. Communication challenges in West Africa impeded the progress of containing the outbreak. Cultural beliefs, particularly burial rituals, were a huge obstacle since they involved cleaning and dressing the dead bodies, and many people refused to report deaths of family members. Other challenges were language barriers due to the variety of different languages and dialects within the three countries. Only a small percentage of the community were literate, which added to the situation. Mistrust prevented infected individuals from seeking treatment and further complicated response efforts. Ebola patients and survivors were stigmatized and shunned from the community. Stigma was also a problem in the US for healthcare workers returning from West Africa. Some of the risk communication strategies and tools used by the CDC included visual materials with pictures such as infographics, flyers, and billboards. The CDC created a crisis and emergency risk communication guide for communication professionals that included tips on how to handle individuals dealing with the stigma of the Ebola virus. Some of these tips include using visuals representing all races and ethnicities, providing scientific, accurate information, emphasizing that Ebola does not discriminate by race or ethnicity, and having a mechanism in place for individuals to express concerns. The CDC made a huge effort to discredit misinformation and rumors that were rampant on social media. Live Facebook and Twitter chats, interviews, and podcasts were used to keep the public and the media updated with critical information about Ebola. Social anthropologists were brought into West Africa to provide support and to bridge the gap between the health system and the communities. Traditional and religious leaders were educated about the virus, and they also shared information with the community. The current Ebola outbreak in the Democratic Republic of the Congo, DRC, is the second largest Ebola outbreak ever reported. It began in August of 2018 and as of today is still not contained. As of December 4th, there have been 3,313 cases and 2,203 deaths. Most of the challenges that were faced in the 2014 outbreak are also being faced during this outbreak, but the biggest obstacle right now is civil unrest and violence. This past November, 4 Ebola responders were killed, and most of the NGOs have pulled their teams out of the region. The dynamics of the Ebola outbreak in West Africa and in the DRC are extremely complex. Increasing awareness of Ebola through effective information dissemination is paramount. Organizations such as Libraries Without Borders, and the International Federation of Library Associations can assist with Ebola awareness campaigns and risk communication by working with government agencies and NGOs to reach vulnerable populations in the DRC affected by the outbreak. Thank you for taking the time to watch this presentation.